Yes, we are live
Okay, so Kanan, can you also post the link? I
on
guess
LinkedIn.
we're going to be on, yes, on the LinkedIn. That'll be nice.
Okay, absolutely.
Thank you. All right, we've got a couple of minutes, a minute only remaining, and we're going to start dialogue series. So let's get ready for that. I believe we are going live as we speak. Hi, Agri. How are you doing? Good to see you. Nice to have you, Jesse, as well. Haneen is here as well. Hi, good to see you.
Hi, good to see you.
Hope you're all keeping warm in this especially cold weather in Athens.
Yeah, we are trying to.
Okay. All right. Well, we'll go ahead and begin our second dialogue series session for spring 2021. And today we have a wonderful speaker from the journalism school, and her name is Euirang Lee. I'll just give a brief introduction about Euirang. Euirang is a second-year doctoral student in the School of Journalism at Ohio University Scripps College of Communication. She is originally from Busan, South Korea, and came to Athens in 2018. Euirang's research interests are in the interdisciplinary areas of strategic communication, health communication, disaster communication, and visual communication. In particular, she deals with examining the effects of health messages, including visuals and text, on people's emotions, attitudes, and behavioral intentions on digital media. The health and disaster issues which she is currently working on for her research include oral health problems, natural disasters such as hurricanes and tornadoes, and pandemic diseases. After receiving a PhD degree, she aims to become a faculty member in the field of strategic communication and health communication in the United States. So before joining the doctoral program at OU, Euirang earned two master's degrees, one in journalism from the University of Missouri, Columbia, and the other in education from the University of Pennsylvania. She received a BA in Mass Comm from Korea University, and she's also worked as a health PR manager for Narsha Hospital in South Korea from 2018 up to now. Euirang is responsible for developing online PR strategies, creating contents for online media channels, such as hospital blogs and Facebook, and reporting social media analytics. She's also previously worked as an English instructor and marketing manager under education settings in South Korea and the US for about 6 years. So as you can get to know Euirang a little bit better through her intro, she has a stellar record, and now we're not going to keep you waiting. We'll go directly to her presentation. So I'd like to invite Euirang to present her. Over to you.
Yeah, hello everyone, and thanks for inviting me to the SMART series. Yeah, and nice to see all of you. Yeah, here, and thanks for coming to the presentation. I'll share. Can I share my screen? Yeah. Yeah, if you can't see me or hear me well, just please let me know. Maybe I won't able to see you. Yeah, on the screen. Yeah. Let me share my PowerPoint. Yeah, and my screen. All right, can you see my PowerPoint? Yeah, oops. Okay. Just trying to minimize it. All right, so if there's any problem with listening to me, I'm just seeing my PowerPoint on the computer, so just let me know, yeah. Can you hear me well? Is it too loud or is it too small?
We can hear you loud and clear, perfectly well, and your slides are visible as well. So
all right, yeah. Okay, I'll get started, yeah. Yeah, my name is Euirang Lee. This is a very difficult name, so don't feel bad if you can't pronounce this correctly. And yeah, and the title of the study is Oral Health Messages Among College-Age Populations, and it's about effects of message appeals and efficacy beliefs on perceived effectiveness. This was like a brief, introduction about me, but Dr. Khan already did it, so I'll just skip this part. Yeah. All right. I'll start with a little bit backgrounds of my study, why I started this study. It's about oral health and college-age populations. As everybody knows, oral health is not just the health of your mouth. It's more about that. It connects to our overall health and also well-being. So oral health is an integral part to maintain your overall health and well-being. And I found a problem about the oral health, particularly among college-age populations, because compared to other age groups, they are unaware of maintaining good oral health through regular dental checkups. They may brush their teeth, maybe they may floss, they may make some efforts, but many some statistics show that college age populations, they're particularly not really aware of going to dental clinics regularly for the checkups. And also another problem is that when there are health messages encouraging regular dental checkups or about other oral health issues, they usually college age populations show stronger resistance toward health messages. It means even if they see some oral health messages, they don't really care about it, or they are so indifferent to it. So that's the problem I identified among this group. So I thought maybe we need to develop more effective health messages to raise more awareness on the importance of oral health issues. All right, the purpose of study was to examine how different types of message appeals, in this case, social focused and health focused, and efficacy beliefs, self-efficacy, collective efficacy, and no efficacy, influenced college-age populations' perceived effectiveness of oral health messages. The theoretical framework I used is psychological reactance theory. This is a big kind of concept developed by Brehm in 1966. Basically, this explains why college age populations particularly have higher resistance toward health messages. So the theory states that when individual freedoms are threatened, in this case through health messages, an aversive motivational state, which is termed psychological reactance, arouses. So when maybe individuals see, in this case, college-age populations receive some kind of health messages encouraging healthy behaviors, they will have aversive motivational states, resistance, toward that messages. And many previous studies have examined how to reduce this kind of psychological reactance under different health contexts. But they haven't really applied this theory to oral health contexts, such as regular dental checkups. So through this study, I wanted to apply psychological reactance to oral health context, particularly regular dental checkups. So as I told you before, this is about my IV. The first independent variable was a type of message appeal. So there were two types. So first was health-focused message appeal, and the other is social-focused message appeal. Health-focused appeal means it deals with short-term or long-term health effects. So for example, maybe we can talk about how smoking influence your lungs, or how smoking affects your health overall. So this is about health-focused message appeal. On the other hand, social focused message appeal include social ramifications of an unhealthy behavior. So for example, it does not talk about health effects of smoking. It would rather talk about like how people would not like to interact with you because of your bad smell or because you're a smoker. So it's about social maybe exclusion. So that would be social focus message appeal. So these are very two different concepts suggested by some scholars. And previous studies about comparing health-focused and social-focused message appeal stated that social-focused message appeal may be more effective than health-focused message appeal, particularly among college-age populations, because they don't really care about the like a long-term perspective health effects. They would rather focus on the present moment. That's why social focused message appeal may be more effective than health focused message appeal among these particularly young population groups. Another IV for this experiment was a type of efficacy belief. The first is self-efficacy. The other was collective efficacy, and there was no efficacy. So self-efficacy deals with beliefs in one's capabilities to organize and execute the courses of actions required to produce given attainments. It's a very famous, I think, concept. Already many people know about it. So it's developed by Bandura. And collective efficacy is people's shared belief in their collective power to produce desired results. So both of the concepts talk about what you are able to do or what we are able to do, what people's abilities to do something, but self-efficacy focuses on individual's ability, but collective efficacy focuses on people's like shared kind of capabilities to achieve a certain result. So many previous studies about self-efficacy, they already kind of have shown that self-efficacy has been like is a strong predictor for recommended oral health behaviors and also other health behaviors. But not many research have like examined the effectiveness of health messages with collective efficacy information. That's why I brought this collective efficacy concept to the study. All right, these are my hypotheses. So hypothesis one is social focus oral health messages would result in less psychological reactance and more positive evaluation toward the message, greater perceived self-efficacy, and more positive attitude toward dental checkups and greater behavior intention to visit a dentist than health-focused oral messages. So hypothesis one basically says that like social focus oral messages in general would be more effective to generate more positive attitude and behavior intention than health-focused oral health messages. And hypothesis 2-1 is about efficacy. So oral health messages with self-efficacy information would be, is the same dependent variable. So oral health messages with self-efficacy information would be more effective than oral health messages with no efficacy information. So without without efficacy information, I thought people would not have like a greater like intention or more positive attitude. And hypothesis 2-2 like asked about whether which health messages with which efficacy information produces a greater behavior intention. So this is about oral health messages with collective efficacy information would be more effective in generating more positive attitude and behavior intention to visit a dentist than oral health messages with self-efficacy information. And research question 1 asks, is there an interaction effect between types of message appeal and efficacy belief on the following dependent variables? All right, here is my experimental design. So it was 2 by 2 by 3. So there were, as I explained, there were 2 message appeals, which are social and health focused. And there were 2 message repetition here. So there were 2 social health focused messages and two social focused messages, 2 health focused messages. And there were 3 levels of efficacy belief: self-efficacy, collective efficacy, and no efficacy. So if you look at the table here, I created like 12 messages. So for example, there is, message with no efficacy, and there's message with self-efficacy and message with collective efficacy. And I created like 2 messages for social focused message appeal. So there were 2 social focused messages with different topics in the same like level of efficacy. So no efficacy is too social focused, no efficacy is too health focused, and self-efficacy has 2 social focused and 2 health focused. So within subject factors were message appeal and message repetition. And between subject factor was efficacy belief. All right, so I created the stimulus based on this operational definition. So there were 12 oral health messages to encourage for college-age individuals to regularly visit a dentist. So the operational definition for the experiment was health-focused. I emphasized a negative impact of oral health issues on people's health. So the topic was about gum disease and cavity. If you don't go to the dental clinic for regular checkup, you'll have maybe you may have a gum disease or you will develop some cavities. That was the health-focused messages. And social-focused messages depicted a negative impact of oral health problems on people's social life, such as bad breath. So if you don't have regular checkup, you'll have bad breath or you will have a tooth discoloration. And efficacy belief was operationalized like this. Self-efficacy explained what an individual is able to do to prevent some negative consequences of poor oral health. And collective efficacy described what a health organization is able to do to help improve individuals' oral health. No efficacy did not include messages about what people can do, but instead it just explains it didn't explain any efficacy information. Okay, this was how I developed the stimulus. These are some examples of it. So I created like a pseudo health organization. So I kind of explained about it before they started the experiment online, experiment like in the lab. So this was a good oral health. This is the name I made. So there's a little bit of explanation about the organization, and these are all created. So if you look at the title here, this is an example of the stimulus of health-focused and self-efficacy. So this is about a tooth decay cavity. So this is health-focused, and this like here, the major, like the one paragraph explains about like how like serious the tooth decay can be if you don't like regularly visit your dentist. And here, the part with the red line, so what is the best way to prevent cavities? This is about self-efficacy. So I also highlighted the self-efficacy here one more time to kind of visually, so for people to see this better. And this is an example of health-focused and no efficacy. So if you look at here, this is about a gum disease, about the health impact of the poor oral health. And this also explains about the gum disease. And here, the red part explains about no efficacy. So this does not talk anything about efficacy. It's just similar. I just put the similar lengths of the text with no efficacy information. All right, these are another examples of stimulus among 12 stimulus. So this is an example of social focused and self-efficacy. So social focused emphasize tooth discoloration or bad breath. And it explained about the tooth discoloration here. And the red part emphasizes like the self-efficacy, what you can do to prevent tooth discoloration. And collective efficacy emphasized like, don't worry about it. You're not alone. We can help you. So what maybe organizations can do together to help you prevent the poor oral health here, I think bad breath, yeah. So this is the procedure and the participants. I recruited 140 college students, and then they were age 18 to 24, college age populations. And this was a lab-based experiment. And people like had an experiment in a group of 1 to 6, depending on the situations. And so when they come, like each participant was exposed to a total of 4 messages. So for example, if participant 1 comes, she or he will be exposed to no efficacy condition, but he or she will see 4 messages, like it's all mixed. So 2 social focused and 2 health focused. And when another participant comes, he or she will be exposed to self-efficacy condition, and she or he will see 2 social focused messages and 2 health focused messages. So one participant saw 4 messages in a row, and they answer to all the dependent variables. These were all dependent variable measures I used. So first was psychological reactance toward a message. So it asked if the message made you irritated, angry, annoyed, and aggravated. And evaluation toward the message was about the overall, like the message evaluation. Was it worth remembering or convincing, meaningful? And the third one was perceived self-efficacy on dental checkups. So how confident are you that you can visit a dentist in the following situation when you have no money or when you're busy, like that. And attitude was about attitude toward regular dental checkup. Is it good? Is it desirable, positive, or necessary? And intention to visit a dentist is how likely is it that you plan to visit a dentist in the next 6 months or at least once a year. So these were 5 dependent variables I asked. So I used a series of ANOVA analysis to test my hypothesis. So this is the result of the hypothesis 1. Hypothesis 1 was not supported. As you can see here, I hypothesized that social focused message would be more effective in general in terms of like psychological reactance and evaluation. but the result was the opposite. So this was an interesting result. So if you can see here, if you see here, health-focused messages had the mean value was lower, so it had less psychological reactance. It has higher evaluation. It had more perceived self-efficacy. It had like more positive attitude toward dental checkups. So for dependent variables like consistently shown that it was statistically significant, but the direction was opposite to my prediction. And hypothesis 2-1 was not supported. And hypothesis 2-2 was partially supported. So if you look at the table here, perceived self-efficacy, so if we compare self-efficacy and collective efficacy, the messages with collective efficacy showed higher perceived self-efficacy and more positive attitude toward dental checkups. So the main effect of efficacy belief on these two dependent variables was statistically significant between collective efficacy and self-efficacy. And research question 1 was not statistically significant. I'll talk briefly about the significance of this study. This study contributed to examining and developing more effective health messages in under-examined health contexts, such as oral health. And the study revealed that the effectiveness of message appeal can be differed among college-age populations with different health issues. Many previous studies reveal that social focused messages were more effective than health focused messages, but most of the research was in the context of smoking cessation. But my context was regular dental checkups. So probably smoking and dental checkups are like different health topics, and people have different feelings toward like smoking and dental checkups. So that may be the reason why the direction of the result was the opposite. So my study showed health focus was more effective than social focused messages. And third, the study also highlighted the importance of employing perceived collective efficacy in health messages. So the previous studies usually employed only self-efficacy, but I think it's meaningful to think about how we can incorporate collective efficacy in health messages. There were some limitations I was able to think about. First, so this was a repeated measure method. So people had to see like 4 messages in a row. That's quite a lot. People were exposed to the multiple messages in a row. That could cause fatigue during the experiment, and they had to answer to exactly the same dependent variables whenever they see like multiple messages. So that can be the limitations. And this was a lab-based experiment. So this could create an environment that was unfamiliar with each participant, because I was in the lab and I was standing in the middle of like the room. So maybe they may feel a bit uncomfortable with it, or maybe it's kind of too artificial. And lastly, the study population, the majority of like participants were white females. Maybe they could the number of white females maybe could have influenced the experiment result. Okay, that's all I prepared. I'll now stop sharing, and if you have any questions, you can ask me. Yeah.
Well, thank you very much, Euirang, for that very insightful presentation.
Thank you.
I'm
Yeah.
so glad that you mentioned experimental research, and that's exactly what I was teaching my graduate students in research methods class just about an hour ago. So, and many of them are here. So it's very good that the topic was very much in line with their areas as well. So I'll go ahead and open the floor to questions. You're welcome to ask any questions to Euirang. You can either raise your hand or just unmute and go ahead.
Hi, Euirang.
Yeah. Hello. Yeah. Sassy. Yeah. Nice to meet you. Yeah.
So the difference between smoking and dental checkups that you found in the efficacy, do you think that might have something to do with the fact that smoking is something that's perceived as enjoyable, where dental checkups really aren't? Do you think that might have something to do with the differences that you found?
Yes, I don't know exactly why this happened because my result was, opposite, right, to the smoking cessation. So that was interesting. The point you talked about, I think, has closely to do with the result. If I'm thinking about the reason why I had opposite direction, I remember I once read like articles about why, young people like to smoke, and maybe one of the reason was like being cool. So I think smoking has smoking, if you smoke, maybe for young people, maybe it can be e-cigarette or whatever. It looks kind of cool in some ways. I mean, it has a sense of like coolness, but dental checkups are not like that, right? So I think it has closely to do with why health focused messages were more effective like than social focused messages in the context of dental checkups. Yeah, but in the smoking cessation campaign, that was the opposite. Yeah, I think that's a good point. Yeah.
All right. Thank you, Jesse. And Euirang, any other questions?
Yes, Shirang, thank you so much for this presentation. It's really quite interesting, and I always love that of the field of health communication, the idea of sharing awareness to the audience. So thank you so much for doing that. And I don't have a question, just like a comment. You're right. I mean, even in the Arab countries, as far as I can tell, so many people, like young people especially, they do smoke because they feel like it's kind of like cool or something like that, or to at least act as an adult. So this is something we might consider. I mean, even for the future campaigns, in order to like send the awareness or send the message. And let people be aware, I mean, of the effect of such behaviors.
Yes, yes, I agree. Like I think different maybe countries may have like different sense of like why we have to do regular dental checkups, or I think it maybe the country I think play a role of it too, I guess. Yeah, okay. Thank you. Yeah.
Absolutely.
I think I have a question. I don't know if you answered this in your presentation. You spoke about the self-efficacy and the efficacy, but are those the theories that are guiding the research, or is there other theories that you're using to guide the research?
Oh, like you mean the efficacy?
Yeah. Are there like other theories that you're using to guide, or is it just based on the efficacy?
Oh, like efficacy is part of the kind of a big theory by Bandura, but my research is like based on the psychological reactance. That's probably the center of the theory I use as a framework, because my purpose was to reduce that kind of, strong resistance, which is psychological reactance toward health messages. And self-efficacy and collective efficacy is part of a big kind of concept Bandura developed, long time ago. So I kind of use it as one of the I kind of like took the one of the concept he developed in his big theory. Yes. I think that social
cognition.
social cognitive theory. Is that
Yeah.
correct? Yeah, yes.
Social cognitive.
So it's part of that it's one of the concept he kind of developed, under that big theory. Yeah.
Okay, thank you very much.
All right, thank you, Ghanem and Vanessa. I had a question as well. Actually, I had two sets of questions. So first of all, what are the implications of your findings for the general healthcare industry? So how can the healthcare industry benefit from what you found in your experiment, number one? And the second one is related to your future work. How do you plan to, if at all, build upon this research and maybe use varied or different methods to explore this area further? If you can shed some light on that, that would be great.
The implications, I think, I started this research based on my practical kind of, question, why maybe young people, maybe including me, okay, like why they don't, go to like dental clinic as often as other age groups. So my research has very practical implications, I think, for health professionals. Like maybe they have to have more kind of segmented kind of target audiences. So maybe for younger generations, like they have to consider their characteristics when they develop health messages. And particularly dental checkups are not, it's really hard to come up with persuasive messages. So I want them to think about like why they don't want to go there. Maybe they have some barriers. Maybe they don't have time, or they don't have enough money, or maybe there should be some kind of ways to persuade them, and there should be some kind of variables we have to test. I tested like health or social, or is it self-efficacy? Is it collective efficacy? Maybe they can find some answers from collective efficacy because maybe they want to talk about this with somebody, but they haven't really emphasized enough information about collective efficacy compared to self-efficacy. So I think there's important implications about using like collective efficacy. Yeah.
And how do you think social norms can play a role in that?
Social norms is another important, I think, variable. Yeah. And many previous studies, like including smoking, yeah, they tested a lot about social norms, but I haven't tested in my study. So social norms can play a big role, like how other people think about this, or how my friends, my peer groups would if whether or not my peer group like often go to dental clinic or not, would I think play a big role. Yeah. That's I think really an important variable. Maybe I should incorporate that in the future study. Yeah.
Okay. And would you be interested in looking at maybe data from websites where people are participating on health-related messaging and explore that further? Is that something you would be considering?
What was the question exactly? Yeah, I didn't understand
For
clearly.
example, in your experiment had two manipulations, sort of, in which you were showing those people who were adhering to some sort of, what was the variable that you had?
Like the two IVs, yeah.
Yes, yes. So the two IVs. So if that happens in the real scenario, in which people are actually visiting a website and maybe leaving some server level data in terms of their interactions, so that might be something interesting that you could look at in the future. I'm aware that one of our Team Smart members who's also here, Agri, he recently published a paper in Health Communications, and I think that explored some aspects of that and I think that was YouTube data, if I'm not wrong. We looked into that.
That sounds interesting. Yeah, that sounds very interesting. Like which kind of messages people read more. Maybe I can maybe find more information. Maybe one thing I'm thinking about is because mine was like a very artificial blog. But if I think about like the young generation, they may be more interested in reading maybe Twitter messages or maybe Facebook messages. Maybe I should change the way I deliver the health messages. This time it was the blog, but maybe that sounds a little bit outdated in some ways. Yeah. So
Team
maybe a
Smart,
little bit shorter messages. Yeah.
so Team Smart members, I think that's very exciting to hear. There you have it. One of the purposes of doing this kind of an activity is to encourage interdepartmental collaboration and interdisciplinary research. So now you know the wonderful research that Euirang is already doing in journalism. So I think I can take the liberty to, since you already know her to some extent, all the other grad students can get connected.
Sure. Yeah.
Any other questions from anyone? Comments?
Yes, I just would like to add something. Yeah, it's quite interesting, Euirang, like to look at other data, like from social media, for instance. And the other thing is to really look for why people don't go to dentals, and maybe sometimes people don't go to doctors until they do have a real problem, to be honest. And this is something that we need to consider. My concern is that is it the case for other age groups? Do you think like old people or other age groups, in order like to consider them with these messages in order to share awareness?
Yes, yeah. My study was like about college age populations.
Okay.
But I think there are other age groups we have to consider, including like older like people, and also depending on races, like maybe like African Americans or Latin Americans. I think I remember I saw the statistics showing that they have very lower rates visiting a regular like dental for regular dental checkups. So I think there are other populations we also need to consider. Yeah. And we need to make some tailored messages for them. Yes.
Yes, that's interesting. And I believe this is a rich field. And I really would like to congratulate you for doing this. This is really, really important.
Thank you. Yeah. And I think just if somebody's interested in doing studies about like maybe, I don't know, health focused and social focused has not been studied a lot, I think, okay, compared to other variables. So maybe we can apply this to other contexts beyond the oral health messages. So beyond oral health messages and smoking. So maybe you can apply this to, I don't know, wearing a mask or maybe vaccine messages. Like you can emphasize other aspects of like wearing a mask, or because everybody interested in pandemic situations now. So if you're interested in health messages, I think we or other people can do some experiments like that. Yeah.
Sure.
All right. Well, thank you again, Euirang. I think this is what we had time for. We're almost nearing the end of our session today. That was a very exciting, very insightful and enriching experience. Thank you very much, Euirang. I'm sure this has provided a great opportunity to everybody who's listening and watching this to benefit from this kind of research. So there are lots of wonderful opportunities that can emerge out of this. So again, I'd like to appreciate your giving time to our dialogue series today. And we'll have another exciting presentation coming up in about 2 weeks, which will be posted on our website, social media channels as well. So keep connected, and we'll see you later.
Yeah. Thank you,
Thanks so
everyone.
much.
Yeah.
Thank you.
Thank you.
Bye-bye.